Welcome to dBrief. Hi, this is Rashika and I'm your host for the day. I will be taking you through the highlights of the webinar on a very vital topic, World AIDS Day, which was recently organized by IMA Mumbai on 6 December and sponsored by DG Shield. As per the recently released India HIV Estimation 2017 report, national adult HIV prevalence in India is estimated at 0.22% in 2017. At present, around 38 million people are living with HIV worldwide. Many of them are not really aware that they are infected and may be spreading the virus to others. On this World AIDS Day, DG Shield joined hands with IMA Mumbai to spread awareness and to clear the minds of many through an interactive session. The session was kick-started by Dr. Suhas Agre, a consultant medical oncologist and hemato-oncologist in Asian Cancer Institute, who began to speak on the topic breast cancer overview and recent advances in management of advanced breast cancer. He shared the statistics which reflected that breast cancer is extremely common in India. He described the broad spectrum of breast cancer and its death rate. To conclude, he suggested the following details. Let's hear what they are.
Obviously, like any of the cancer, breast cancer is not an exception, and early diagnosis would be the key in the management. And if it can detected early, we can improve the outcomes. The number of the new drugs are in the development, are in the rapid development, and ultimately the targeted therapies continue to emerge with the goal of improved effectiveness, but at the same time, they are having a minimal possible, that to manageable side effects.
Dr. Preeti S. Mehta, a consultant pediatric hemato-oncologist, started speaking on the topic Changing Outcomes in Severe Aplastic Anemia with Eltrom-Bopac. She shared the basics about the aplastic anemia along with the various available treatment options. She explained in detail the process of Eltrom-Bopac in refractory aplastic anemia and the different diagnostic procedures available. To provide an interesting end, she concluded by saying,
supportive care is essential. Eltrom-Bopac definitely induces a tri-lineage hematological response, and it has been considered as the first-line treatment option along with immunosuppressive therapy. It is now approved in India. It has the maximum impact if started on day one, along with the immunosuppressive therapy, and look at the response at the end of 6 months. The overall response has been around 94% with a complete response of 56%. The safety profile is quite okay as it has been used in other conditions like chronic ITP, HCV. There are no major side effects with Eltrom-Bopac.
Up next, Dr. Shruti Tapaiwala, a consultant at the Department of Nephrology in Sir H.N. Reliance Foundation Hospital and Research Center, shared the thoughts on the topic HIV and Kidney. She started off by giving a brief idea about the cases and their complication and the diagnosis of the same. Then she explained the HIV and renal disease and its harmful implications, along with which she provided the clinical features of HIV. She concluded by suggesting certain facts. Let's dive into the video to understand it.
Renal involvement is very common in HIV infection because of multifactorial reasons. There are varied presentations and tailored treatment is required. A multidisciplinary care is required. If picked up early, we can prevent complications leading to AIDS-related cancers. HIV-infected patients with ESKD can now be given an equal opportunity for transplant as given to non-HIV patients.
Dr. Paresh A. Jain, a consultant laparoscopic and robotic colorectal surgeon at Sir H.N. Reliance Foundation Hospital, began his lucid speech on the topic Scar to Scarless Colorectal Surgery. He shed some light on why colorectal surgery is treated as a specialty and the changing trend in approach towards cancer patient. He also explained the different surgical procedures along with the current scenario in India. To conclude, he suggested the following things. Let's know what they are.
In today's era, everybody should be offered a keyhole surgery, and at least offered. You don't need to go ahead with everybody. You need to select your cases, but yes, that offering, you should have it in your mind that yes, probably look for a reason why you want to do it why you don't want to do it as a keyhole. No compromise. Again, there is no compromise on the oncological outcome. At any point of time you feel your oncological safety is hampered, you have to consider open surgery itself. So there is no compromise at all. And again, just because I have the hammer, I should hit it doesn't make sense. If it's a large T4 rectal tumor invading into the prostate and the into the prostate or the back wall, I definitely would prefer to do it as an open surgery rather than laparoscopic surgery. And patient comfort and early recovery is now the necessity. It's a patient-centered approach rather than surgeon-oriented approach. It has to be patient kept in the center and see what the patient really wants and make your treatment feasible around it, so that if he's happy, you will be happy. And that's how things have evolved. And that's why we still say necessity is the mother of invention.
Dr. Amar Pazare, a professor of medicine at Soumya Medical College and Hospital, Mumbai, started to address his topic, Interesting Cases in HIV. He shared and explained the complications of each case and the required treatment that must be provided. At the end of his lecture, he shared certain guidelines. Let's just know what they are.
HIV treatment, any regime can be started in patient. AZT-based regime was tried considering it may work because of AZT is a myelosuppressive drug. It can cause bone marrow suppressions. So possibly this may cause the improvement in polycythemia, but it won't work. It is not working. So additional drug has to be given required for polycythemia. Hence, as per WHO, we started patient on the TDF, lamivudine dolutegravir, started quite 1 or 2 years back only, this recent patients. So patient needs a separate therapy for polycythemia and separate for the AZT. No, there is no drug interaction. If hydroxyurea use, then possibly we don't use the AZT because it will cause a bone marrow suppression both the drugs. So we have some little problem. But most of the drug, TLD is safest drug we can use in this patient of polycythemia.
The webinar ended on a good note when Dr. Mala Kaneria, who is a professor and unit chief, Department of Internal Medicine at BYL Nair Charitable Hospital, Mumbai, began to speak on the topic HIV and Coronavirus Disease 2019. He started off by explaining the impact of COVID on HIV, followed by some statistics regarding the death. She laid down specific important questions which one must ask themselves in such a situation. To conclude, she provided a gist of the important points that one must keep in mind. Let's just know what they are.
So the recommendations of these people are that in such a situation, they should keep an ample medication supply ready, keep vaccinations up to date, establish plan for clinical care if they are isolated or quarantined, such as telemedicine option or physician online portals, maintain a social network but remotely, because social contact helps us stay mentally healthy and fights boredom. And to summarize, HIV, TB, COVID has to be viewed as a high-risk population. Given the urgency of COVID-19 pandemic and the rapidly changing information about the disease, a high degree of vigilance is needed on the cause of infection in these patients. Bed-controlled HIV patients are not associated with a poor outcome. Particular caution is needed for patients with low CD4 count, advanced disease, high viral load, and those not on ERT. TB, HIV, and COVID are immune-suppressing infections and may lead to further OIs. In the future, lung lesions associated with COVID-19 will increase the risk of PTB, which induces a truly vicious circle of HIV, TB, COVID co-infection. And as people living with HIV are today living longer with ART, many of them will have chronic conditions associated with severe COVID-19.
Deepen Mehta, COO in DigiShield, took the chair where he discussed in detail how DigiShield is enabling doctors to safely and securely practice these testing times of COVID-19. DigiShield can conduct a quick and effective COVID-19 carrier risk screening of every patient before visiting clinics. To know more about DigiShield, log on to www.digishield.me, and to watch the complete webinar, click on the dBrief menu. For now, this is Rashika signing off. Until next time, stay safe, stay strong.